Well, in the fight against addiction, healthcare providers have an important warning today about treatment, especially for back pain.
Yeah, joining us now to explain why is health anchor Liz Bonus. Liz.
Hey guys, good afternoon once again, and good afternoon to you. That warning today about treating back pain, they want you to treat it sooner rather than letting it go. Now, this is all part of a push to keep people from getting hooked on pain medications. Since it is estimated that 8 in 10 of us will have back pain at some point in our lives, either acute or chronic, they want those of us, or at least those that coordinate care for the St. Elizabeth Spine Center in Greendale, Fort Thomas, and Florence, to do more with chronic pain. And they remind all of us not to let it go. When you let it go, it gets so bad and you can't stand it, and then you often can't turn it around. Brad Bolte told me today it's one of the reasons you may need to ask your primary care doctor to refer you to a spine specialist sooner rather than later.
They can see our providers for any kind of spinal injury, if they have some kind of chronic pain, if they're dealing with neurological pain, just pain that simply won't go away. You've been going to your provider and it's just not getting better, and long term, how can we do it? We try to do it very conservative, where we're trying to really cut back on the narcotics, and we're really trying to look at the alternative medicines, physical therapy and management and some injections. We do some procedures there as well.
A lot going on there over at Griffin Elite, where we talk to him. You can also self-refer if you've been letting it go. The number that is at that spine center is 859-212-7000. No wrong way to do it, but one of the things we're trying to do is just get people to think differently. Most of the time you're like, I can gut it out, I can hang on to it. And then what happens is if something's disintegrating, it gets so bad that physical therapy or something won't help.
And back pain can be so excruciating.
Yes, and nobody wants to do something really invasive before they have to, like a surgery, but if you let it go, sometimes you can't ever get anything, and that's how people get hooked to pain medications.
I'm the worst for delaying, but I will say, you always tell me it's not supposed to hurt. Things aren't supposed to hurt. That's a warning.
Pain, somebody once said to me, pain is your body's way of telling you to do something. So it can be emotional pain, it can be physical pain, it can be spiritual pain. Somehow that's telling you to reach out. And we have great resources, quite often at very low cost. Even an evaluation doesn't cost you much other than a copay. So they're bringing up back pain because that's one of the #1 ways people get hooked now to medications. We've got to think of this on the reverse side. Speaking of that,